Hello, my name is Dr. Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to talk to you about what happens when a nurse takes you to your exam room at the doctor's office. Usually, the nurse will get some measurements. We call these your vital signs. And vital signs include your height, weight, temperature, oxygen level, heart and breathing rates, and blood pressure. Let's talk about each one. A nurse will come to the waiting room door and call your name. Follow the nurse into the clinic area and bring whomever you want to bring with you. The first step is to check your height and weight. You will usually be asked to take off your coat and your shoes. The nurse will show you how to get on the scale and ask you to stand still. The scale will measure your weight. She will tell you when you can get off. If standing for a weight is hard for you, tell the nurse. To check your height, you will keep your shoes off, and the nurse will show you where to stand. You should stand with your heels and back touching the wall, and try to stand still with your feet together and flat on the ground. Ask the nurse if you're not sure what to do. The nurse will slide a flat bar to the top of your head, and you can step out when the nurse tells you you are done. Some people who move in wheelchairs can't stand for their height. If you cannot stand, the nurse may use a tape measure to check each part of your body and measure your height instead. Next, the nurse will check your temperature. There are different types of thermometers. One type does not even touch you. The nurse just holds it near your head while you sit or stand still, and it'll usually beep when it's done. A different type has a stick that the nurse puts under your arm or under your tongue. This one might take 10 to 15 seconds to get your temperature, and it beeps when it's done also. If you find it hard to have a stick in your armpit or in your mouth, just tell the nurse. To check your blood pressure and heart rate, stay as still as possible. Most machines go on your upper arm, but some go on your wrist, and there are even ones that go on your leg. The nurse will wrap the cuff around your arm or leg. The cuff will give your arm or leg a tight hug. And then the hug gets looser step by step over a few seconds. The nurse will take the cuff off when the machine is done. Tell the nurse if having the blood pressure machine on your arm is too hard a test for you to do. To check your breathing, the nurse may count how fast you are breathing. She might put a stethoscope on your chest while she counts. She may also clip a little machine on your fingertip that tells you your oxygen level. After checking all these measurements, the nurse will also ask you some questions. She will ask why you have come to the doctor's office and if you have any questions for the doctor. She will go over your medicines. The nurse might give you an exam gown to put on. The nurse now is ready to leave the room, and she'll go tell the doctor that you are ready. You'll wait in the room until the doctor comes. It is okay to ask the nurse how long it might be before the doctor comes. That finishes our talk about going back to the exam room at the doctor's office. Thank you for watching. I hope this video helps you feel ready to go to an appointment at your doctor's office. For more videos and other ideas for being healthy, please visit our website, forourhealth.org. Thanks.